Hi, everyone. Steve Adubato with my colleague, Mary Gamba. Welcome to Lessons in Leadership. We're now joined by Jamie Grill-Goodman, who's editor of Commerce Magazine. Jamie, good to see you.
Hi, nice to see you too.
Tell everyone what Commerce is and put the website up.
Sure. We are a magazine that is part of the Commerce and Industry Association of New Jersey. So it's a very large group of people who come together to support businesses in New Jersey. And the magazine is sort of the flagship publication of that. And we talk about members and their businesses, people who are in business in New Jersey, but also outside of the membership as well, just anybody who does business in New Jersey across many, many industries. And we try to bring them together and give you lots of, human interest pieces on what's happening.
Yes, and to disclose, Commerce is a media partner of ours, and my column on leadership appears in the magazine. Jamie, let me ask you this. People don't often understand what the role of a quote of an editor is. Oh, the editor or publisher, they're the same thing. They're not the same thing, but also media is not the same. Media has evolved. The difference between an editor and a publisher is?
Publishers usually run the magazine or media outlet themselves. They run everything kind of at a higher level. They do sales for the organization, things like that. Whereas the editors really were kind of hands-on. We're doing the nitty-gritty day-to-day work to make sure what you see or hear out there in the media is happening. So that anything from, finding stories, writing stories, editing stories, helping with layout and the look of things, getting things out there. And the way media has changed today is so different. It used to be, maybe a print magazine and that was it. But, today people want content. They want newsletters. They want video. They want social media. They want it on the mobile. They want webinars, podcasts. There's so many ways that people are consuming media today. So now, we're kind of really like a jack of all trades trying to do video and writing and downloads and interactive digital. And, there's so much going on now. So
Yeah, there's no one way. And by the way, check out our website for a previous interview we did with Tony Russo, the president of the Commerce and Industry Association, with Michael Shapiro of Tap Into and the partnership between the two media entities. Mary, please jump in.
That was a great segment, Steve, and definitely go to stand-deliver.com to check that out. And Jamie, want to talk a little bit more about trust in the media. You're talking about content and how the editor, aka you, decides what is going into that content. How do you make sure that the information that you're putting out there is relevant so you get the trust of your readers, your viewers? How do you do that?
Yeah, well, because we're B2B, so that's business to business magazine. So, our audience is other businesses. So we really get out there. We talk to people. We want to hear, what is it that they want to hear? What are their stories? We're really trying to be a publication that really taps into the interesting things that are happening in New Jersey. And so we are often talking to our members and talking to people to find out what is of interest to them. And then as far as trust in the media, I would say that I think sourcing is really important. So we do a lot of human interest pieces. So there's a lot of quotes and things like that. But, we try, you don't want to take sound bites, take them out of context. If you have sources, facts, you want to make sure that those facts are backed up, that they are, real sources. They've come from maybe studies that are a year old, that there were a decent amount of people in those surveys and reports. I hate when I read stories and I'm researching for something. I'm like, oh, that's great. I want to add that. And then I go down the rabbit hole. Where did this come from? And it's like, oh, a study from 5 years ago and 100 people took the survey. And just, we try to build trust with our readers by making sure that we're using really top-notch quality facts and sources in our writing.
Jamie, let me ask you. We've asked virtually every leader in their respective field who's come on about artificial intelligence. To what degree do you believe, and who could really predict or know for sure, to what degree do you believe artificial intelligence will over time replace us in media or simply shape what we do in media?
Yeah. So I actually have been reading and studying about artificial intelligence for a long time because before I worked at Commerce, I worked for retail technology B2B. So I have a lot of history with, what's going on in AI. And I really do, it is coming. It's going to be here. It's going to affect a lot of things. When it comes to journalism, I kind of have a twofold answer. I think that it's, very useful, as they say, AI is not going to take your job, but somebody who knows how to use AI probably will in the future. So I think we need to get on board and quickly with how to use it to the best of our ability. And in journalism, there are amazing things like I'm not a great typer. I never have been. So now I record any events I go to and I run it through an artificial intelligence platform that transcribes it and spits out everything that was said. So then I can go in and get my notes, and make sure that I'm not misquoting somebody. That's an amazing time saver. So there are definitely amazing ways to use AI in journalism. However, I think, we have to be very, very careful. It's a slippery slope.
That's right.
You can't just copy and paste an article. You need to be fact checking what you are using. It's, to me, better for brainstorming than it is for reporting. And anything with that needs a human element, you still need a journalist for. This is not going to be writing articles, I think, fully in the future, or at least I don't think it should.
Mary, to Jamie's point, one of the things I find interesting about artificial intelligence in media is that someone will take text, or there'll be text that an artificial intelligence platform spits out. And then when the artificial intelligence mechanism, or whatever you want to call it, turns it into video with audio, the audio often mispronounces people's names or gets the names of organizations wrong because they interpret what that name of the person or the company is. And I say, no human being did that, because that's not the name. And let's, as I said, with a grain of salt. Mary, jump back in. We've got about a minute left.
Sure thing. I'd like to really pivot. We talk a lot about wellness and leadership on Lessons in Leadership, and just hearing what you were saying today, talking about being B2B, you're supporting all these businesses, you're trying to help businesses. What do you believe is one of the keys to wellness and well-being, especially 5 years now, post-pandemic? Talk about your viewpoint on wellness and leadership in our business community today.
I think now more than ever, employees want to feel supported. We're in a strange time right now. There's tons of layoffs. There's, tons of talk of AI taking jobs, things like that. So I think mostly employees just want to feel appreciated and heard. As far as wellness, it goes way beyond, Pizza Friday now. Like, it's got to be deeper. It's got to be like a true concern for your employees. And I just, I think this is the way that you need to move if you want to secure talent in any industry, really, because, there's plenty of workers out there, but if you have good workers, it's a lot easier to keep them than it is to get new ones. So, I think it's important to, really, be concerned about your employees' mental health, because if they're happy, they're going to do a better job. So.
Yeah, the wellness issue is critically important for any organization. It's not that's an extra thing. No, that's the thing. People taking care of themselves and organizations caring about their folks. Jamie Grill-Goodman, who's editor of Commerce Magazine, one of our media partners. Jamie, thank you so much for joining us. We appreciate it.
Yeah, thank you so much for having me.
You got it. Stay with us. We'll be right back. This edition of Lessons in Leadership is made possible by the Buccino Leadership Institute at Seton Hall University, Prager Metis, Valley Bank, the International Union of Operating Engineers Local 825, the North Ward Center, the New Jersey Sharing Network, the Helix, Horizon Blue Cross Blue Shield of New Jersey, Fedway Associates Inc., Port Authority of New York and New Jersey, Choose New Jersey, and Seton Hall University, showing the world what great minds can do since 1856.
This is Mary Gamba. If you want more leadership tips and tools, log on to stand-deliver.com.
Promotional support for this edition of Lessons in Leadership with me, Steve Adubato, and my colleague Mary Gamba has been provided by NJ.com, NJBIA and New Jersey Business Magazine, CIANJ and Commerce Magazine, and the Meadowlands Chamber and Meadowlands Media.
When the cost of healthcare depends on how many procedures or tests are performed, we end up with more care, not necessarily better care. But when we partner with New Jersey doctors and hospitals to tie what we pay for healthcare to the results doctors and hospitals deliver for our members, we help drive better quality care that lowers costs for patients. Because all of us in healthcare have a responsibility to lower costs so our members have access to the right care at a fair price.
We're now joined by Dr. Nicole Harris-Hollingsworth, who is the Senior Vice President, Social Determinants of Health, Hackensack Meridian Health, a longtime underwriter of our health-related programming. Dr. Good to have you with us again.
Glad to be here.
Now, we're taping this at the end of January 2025. It will be seen later, but January, we were just talking before we got on the air, is in fact Human Trafficking Awareness Month. First, talk about the crisis of human trafficking as to where we are right now. And then we'll talk about why it is a potentially bigger problem as the World Cup comes to New Jersey in this region. Please, Doctor.
All right. So human trafficking is the use of force, fraud, or coercion to entice or force someone into acts of sex or labor against their will. This is a tremendous issue, not just because, unfortunately, the United States and Mexico are number 1 and 2 in the world as it relates to human trafficking. But with the upcoming World Cup and club games that are going to be occurring in the state of New Jersey, we know that that activity is going to increase dramatically over the next several months and up until the end of World Cup.
Why is that it increases? I've always heard that, but I don't really understand why. And please share with our audience.
Sure. So we're scheduled to get approximately 1 million new visitors to our state over the course of these games. Unfortunately, with large sporting events, this is a business for some. And so they travel to wherever the large sporting event is to offer these services, both in terms of the sex trade, but more importantly, in terms of the labor trade. A lot of the construction workers and the like that are engaged are being trafficked. They're coming in against their will.
I'm curious about this, Doctor. Help us understand, from your perspective, how high a priority this issue of human trafficking appears to be to the leaders who could make a difference in this regard, which isn't just government. It's healthcare, it's law enforcement, it's all kinds of folks. To what degree, let me put it simply, to what degree is the issue of human trafficking, from your vantage point, seen as a high priority situation, problem that must be confronted?
Right. So human trafficking is such a high priority that it's been named for our institution one of the top 7 areas of focus for 2025. And it's human trafficking and the violence that comes along with it. We know that while there are the 2 main types of human trafficking, both sex trafficking and labor trafficking, with the increase of migrants, with the increase of changes just in laws around immigration and services, that we're going to see people vulnerable to that, plus baby trafficking and organ trafficking, and all sorts of untoward enticements that will keep people, unfortunately, bonded in this way.
Explain to folks why this issue of human trafficking is, in fact, a healthcare issue.
It's a healthcare issue because when we see individuals who are coming into our facilities or to any facility across the state, they're coming in with an assortment of bruises, injuries, and the like. We need to understand the true cause of that risk. We know that young adults are being taken advantage of and being, removed from a whole assortment of sites. We know that vulnerable populations, again, including individuals who may be undocumented or may be undereducated or underinvolved, are being taken advantage of. It's a form of modern day slavery, and that's something that we want to prevent.
Listen, I want to understand this. When you say it at HMH, and also to disclose, I've done a significant amount of leadership coaching at HMH as well. And so I've talked to so many different leaders about these and others related issues. So I'm curious about this. When you say it's one of the 7 priorities of the organization, to do what?
So it is our priority to both address the human trafficking that we're seeing within our patient population, but also ensure that they are connected to community resources. We know that the average trafficking victim comes into a hospital 7 times before they're willing to admit that they're being trafficked. So we want to make sure that for anyone who is brave enough to disclose their status, that we're able to connect them to the community services and to transition them from being a human trafficking victim to a human trafficking survivor, and make sure that they're connected in a way that brings them back into independence.
Doctor, I'm going to try to broaden this discussion in this way. So, I'm fascinated by communication and the connection between leadership and communication. You have been part of the public health infrastructure, the leadership of the public health community for a few years.
Yes, thank you. That's very kind.
But here's what I'm interested in, and here's what I believe our audience needs to be interested in, or should be interested in. I hope they are. It matters. Big picture question, I know. There are a significant number of Americans who, quote, don't trust the public health infrastructure, particularly 5 years after COVID became a horrible reality in our lives. To what degree do you believe the leaders in the public health community need to communicate in ways that are not just understood, but trusted at a higher level? I know it's a loaded question, but if we don't trust those who know best, then who the heck are we trusting?
That is a loaded question.
I know, but is it a legitimate question in terms of public health and information about public health?
Right. So the basic understanding between healthcare and the community is that a hospital is a place that should be safe. And so when you're looking at the way in which we're communicating, what we communicate is safety. Come here and be safe. All of the laws. Come here and be safe. We will take care of you. We will protect you. So related to human trafficking or any other priority, we have to continue to communicate that message. We will help you be safe. We will help to, if you get yourself in some kind of trouble, we will help rescue you. And that's, again, what we saw in COVID. And unfortunately, it's what we believe we're going to see in human trafficking during COVID. Despite the confusions, people still, in the end, when it all went wrong, you come to the hospital. When it comes to human trafficking, we want you to know if it's all going wrong in life, come to the hospital and we will ensure that we can connect you to places that will help you be safer.
Extremely well said. And also, let me add this. One of the other areas outside of human trafficking that we're going to be engaged in a public health awareness initiative in cooperation with HMH involves vaccine education, vaccine awareness. Why? And I'm not going to get on my soapbox, but I'll just say this. Because credible, legitimate, accurate, important information about vaccines is more important than ever before. Doctor, if you want to comment on that, fine. If not, it's okay. But it seems to me that is our responsibility. Please.
I agree with what you're saying. I do believe that hospitals do have that credibility. We at HMH have that credibility on both sides of it. We have both the credibility around our information as well as the longevity. We are going to be here. HMH, through its various iterations, has been in New Jersey and at the heart of New Jersey for more than 100 years through its varying incorporated hospitals. We're going to be here for the long run to help people. And being vaccinated is a part of the public health responsibility and the community's commitment in keeping itself safe.
Dr. Cannot thank you enough for joining us. I promise you, as things move forward, particularly on the public health front, we will have you back to join us and get us up to date with accurate, important, credible information. Thank you, Doctor.
All right. Thank you, Steve.
You got it. Stay with us. We'll be right back.
This is Mary Gamba. If you want more leadership tips and tools, log on to stand-deliver.com.
Promotional support for this edition of Lessons in Leadership with me, Steve Adubato, and my colleague Mary Gamba has been provided by NJ.com, NJBIA and New Jersey Business Magazine, CIANJ and Commerce Magazine, and the Meadowlands Chamber and Meadowlands Media. Welcome back to Lessons in Leadership. Steve Adubato with the terrific Mary Gamba. Hey, Mary, I'm going to throw something at you. Nothing physically, other than my soft New York Knicks ball. Scarlett, isn't that soft? See? Nobody got hurt. So I've been thinking about this. We're taping this at the end of January. And there's going to be nothing dated about this because the tragedy of what has happened in California with these fires, and we don't know how things are going to progress. But one of the things that hit me was I got this, this obsession, Mary, with book, which is in our leadership library, Extreme Ownership. Like, who owns it? What is that question I always ask, Mary? Who's the what?
Who's the quarterback?
Who's the quarterback? Meaning, who is the person responsible for this? And this is where I struggle, because as the fires were happening in California and people were losing everything, and some people lost their lives, all their possessions, their home, so much, very quickly, fingers got pointed. It was the mayor. It was the governor. It's a picture of the head of the fire department at the time. I don't know if she's going to still be there. I don't know. Water levels were too low, and why weren't they ready? I don't know. And then I think, here's the question I'm going to ask Mary. Are there certain horrible things that happen, like these fires and the winds being what they were, and the brush being as dry as it was? Are there certain horrible situations that there is no quarterback to hold responsible, that even if everyone's doing their best, it just happened?
In certain situations, and I can't believe I'm going to say this, and again, as you know, none of this is scripted, what we're going to be talking about.
Well, I think people can tell now. It's not scripted.
Exactly. And well, because I know what my gut tells me, and I know what I want to say, but I also know what your reaction is going to be.
It's not black and white, Mary.
It's not black and white. But in this situation, it is so huge. It's so larger than life. It's so bigger than one individual. It's not like, with the Secret Service, we had talked about that previously, and who was responsible with the attempt on
President
Donald
Trump. I mean, they missed the guy that was on the
that was a lot easier. That was a heck of a lot easier because there were specific procedures and protocols and things that were missed.
Agreed.
This is an act of God. This is a natural disaster. So I believe, based on that question, you can look back at different aspects. Who was responsible for making sure that the water levels were what they were? Who was responsible for making sure that all of their walkie-talkies were on the right channel so all the same information is being communicated? Who is responsible for communicating to the public? Who needs to evacuate? There was confusion around that. Who needs to stay?
And when?
And
when?
when?
Too late. Right,
exactly. So just to bring it all the way back, I mean, sure, in that situation, should it be the governor? Should it be the president of the United States? Should it be the head of FEMA? In that situation, I almost want to say they get a pass in terms of having one quarterback, because it was such a huge act of God and impacted so many different things. I think there was one person responsible for the water, maybe one person responsible for the communication.
Many quarterbacks?
Yeah. Mm-hmm. I think in this situation, there were different quarterbacks responsible for different aspects of the situation.
Elvin, you probably don't want to come in right now, but I'm going to ask you to. Elvin Badger, our great director, who is also terrific on camera as well. Talk about multitasking. So, Elvin, here's where I struggle with this. And this isn't a New Jersey thing. It's not a California. It's a leadership question. And is it fair to say that while no one we don't really know how different fires started, that couldn't have been stopped, that's not the same as saying, well, then you still needed to know where the water levels were. It still mattered, as Mary said, who got told when to evacuate. That's separate. Those things are separate and contributed to a horrible situation, but no one is, quote, responsible. Because I heard this president come in and say, this wouldn't have happened under my watch. And I'm not trying to be critical of President Trump, but when he said that, I thought, how would anyone stop that? I mean, those are natural, horrific disasters. Is there a way we could talk about this on leadership and not politics? Because that's the only way I want to talk about it, on leadership. I don't think anyone could stop it, but I do think certain people in leadership positions potentially made it worse? Go ahead, Elvin.
No, I don't think they made it worse. No one in leadership positions. I think the only thing I think that was done that was incorrect or that was wrong was President Trump saying that it wouldn't happen under his watch. Because in actuality, it would have happened under anyone's watch.
But the water, but hold on, Elvin. I happen to think you're right, regardless of who people voted for. That's not the issue.
Right, yeah, that's not the issue.
But and then someone said, well, the water levels, it wouldn't have mattered because you couldn't stop the fires. But if you still couldn't get to a fire, if a fire hydrant was empty, that's from a leadership and management point of view. You got to agree that's a failure.
That is a failure. But from other news programs that I watched, they said that fire spread so fast, even if the pumps were working, they still couldn't stop it.
Mary?
Agreed. That's my point.
You said they get a pass.
I believe that you should, in this situation, and again, every situation stands alone. In this situation, the leaders better use this as a learning opportunity to avoid these mistakes, in the future, to put protocol together, and they acknowledge that, sure, maybe it wouldn't have made a difference. Maybe it would have made a difference to one person's home, and that's enough for me. But in my opinion, in this situation, I don't believe there is one quarterback. I think that, sure, there's lessons to be learned no matter how well or not well a situation goes down. But this was such a huge force of nature. I mean, there were no words to put to it. So in this case, I believe that the leaders should get a pass, but they should definitely learn from the experience.
Real quick, Elvin, on this, got a minute left, as you know, because you're telling us in the chat as our director. Why do you think there's such a propensity, an obsession with being, quote, so quick to blame people in leadership positions, regardless of the circumstance? Because that happened quick.
I think that's because people don't want to be held accountable. So they pass the buck to someone else so the finger's not pointed at them.
It's so interesting. The head of the fire department quickly blamed the municipal administration.
Because everyone's out for their own job.
Yep.
So Mary, is the CYA cover my behind mentality alive and well, not just in California, but
everywhere? Everywhere. Look at
how powerful an instinct is that for us? I got to cover my behind and I'm good.
We're human beings. It is powerful and it is alive and well, and it's been here for centuries, and that's never going away.
So, Steve, you know what I've done in my time always?
Go ahead, sir.
Whenever I don't agree with the decision that was made and with someone I'm talking to, I do a follow-up email, just confirming the conversation that we just had. So when that decision that was made wasn't the right decision, I don't have to say I told you so. It's in an email.
Already done.
Hold on 1 second. You know, that is so unfair of you to put in the chat that we have a few seconds left. And for you to say that...
We got to wrap. We'll pick this up on the next episode.
That was not fair, because I have things to say about those emails you're sending, because you sent some to me. No. For Elvin and Mary and our entire great team, Lessons in Leadership, thanks for watching. We'll see you next time. This edition of Lessons in Leadership is made possible by the Buccino Leadership Institute at Seton Hall University, Prager Metis, Valley Bank, the International Union of Operating Engineers Local 825, the North Ward Center, the New Jersey Sharing Network, the Helix, Horizon Blue Cross Blue Shield of New Jersey, Fedway Associates Inc., Port Authority of New York and New Jersey, Choose New Jersey, and Seton Hall University, showing the world what great minds can do since 1856.
This is Mary Gamba. If you want more leadership tips and tools, log on to stand-deliver.com. That's stand-deliver.com.
Promotional support for this edition of Lessons in Leadership with me, Steve Adubato, and my colleague Mary Gamba has been provided by NJ.com, NJBIA and New Jersey Business Magazine, CIANJ and Commerce Magazine, and the Meadowlands Chamber and Meadowlands Media.
When the cost of healthcare depends on how many procedures or tests are performed, we end up with more care, not necessarily better care. But when we partner with New Jersey doctors and hospitals to tie what we pay for healthcare to the results doctors and hospitals deliver for our members, we help drive better quality care that lowers costs for patients. Because all of us in healthcare have a responsibility to lower costs so our members have access to the right care at a fair price.